Thank you, Justin.
Well, today's Health Chat, we're talking about National Stroke Awareness Month, which is observed in the month of May.
So strokes can be dangerous and deadly, and it's important to know how to respond quickly if you or someone you know is having a stroke.
Joining us live this morning is Dr. Adam Blanchette, a neurologist at Methodist Hospital and the medical director for the stroke program there. Easy for me to say. Good morning, doctor. Thanks so much for taking a minute to talk with us this morning. What is a stroke, and what are some of the more common symptoms we should know about?
Good morning. Thanks for having me. Yeah, stroke occurs when a part of the brain loses its blood supply, and that usually occurs with a clogged artery. And so that part of the brain is dying. The common symptoms one might see with a stroke, we use a mnemonic to help us remember. B fast, B-E-F-A-S-T, B standing for balance or walking difficulties, I standing for vision issues or double vision, F for face, where you see facial weakness, A for arm weakness, it usually involves arm and leg weakness, S for speech difficulties, that can entail slurring of speech or not getting words out, and T for time, reminding us that brain is that this is a time-sensitive issue, and brain is time.
And these are some of the warning signs. What should a bystander do if they see these signs or they think someone's having a stroke?
Well, a stroke is a medical emergency, and that's what we get out, particularly around May, to get that word out. We think about a heart attack, we think about other major emergencies, and stroke is one of those. Stroke is a medical emergency. You need to activate 911. You need to activate the medical emergency services.
Dr. Blanchette, you hinted that time is of the essence when it comes to this sort of medical crisis. Why is it so important that treatment be immediate?
Well, as I mentioned, the brain is losing its blood supply and it's dying. For every minute you're having a stroke, 2 million brain cells die. And so, time is brain, as we talk about. So the sooner you can get to a facility that can treat that problem, we can slow down, reverse that dying of the brain.
And Dr. Blanchette, Methodist Hospital is classified as a comprehensive stroke center, the highest level of certification for hospitals with specific abilities to receive and treat the most complex stroke cases. Are there any advanced treatment options available to treat the most complex cases?
Is correct. Yeah, comprehensive stroke centers have the highest level designation. And so we have those clot busting medications one might hear about, but we also have the ability to do what's called a thrombectomy, or the ability for our surgeons to mechanically go into the artery and actually remove those clots, and similar to a heart catheterization one might see.
And on the screen, some prevention measures we're looking at. One of them is to manage blood pressure. That's correct?
Correct. I tell people the best way to take care of a stroke is not to have one. Do your screenings. Diabetes, blood pressure, obesity, these are high risk for stroke. I always joke I try to run myself out of business, so, take care of those things before you need us.
All right, Dr. Adam Blanchette, neurologist over at Methodist and stroke expert, thank you so much for taking time to talk to us. We appreciate your time.
All righty, thank you.